I want to talk about Dr. Tom Culleton, a student of Dr. Ted Carrick, who is the father of functional neurology. In fact, him and my optometrist, Dr. Smith, began working together. And one of the first things that he did was test my vestibular and visual pathways by spinning me in a chair while wearing a pair of goggles that would videotape the motion of each of my eyes. This is called video nystagmography, and it's used to test the nystagmus, or involuntary movement of the eyes. Now, involuntary movement can be totally normal. We all have automatic reflexes for our eyes, or it can be the result of an imbalance in the reflex centers. Let's look at a normal reflex that I'm sure you all are very familiar with. So if you look at me and you turn your head one way or the other, your eyes are going to move the opposite direction to keep your eyes on me, right? What's really cool is that this happens in the dark with no visual stimuli. It's a normal reflex termed vestibulo-ocular reflex. And as many of you know, this motion is sensed through the semicircular canals, which is this little system by your ears. It senses motion, position, gravitational pull, rotation, and it's very connected to eye movements. So when you spin to the left, these canals sense the motion, and your eyes should move in the opposite direction, followed by a corrective movement back to the original position. There's two conflicting mechanisms going on here. Part of your brain wants your eyes to look straight ahead, and the vestibular ocular reflex wants your eyes to move in the opposite direction of movement. So your eyes kind of ping-pong back and forth while these two reflexes battle it out. We call this nystagmus, and it happens while you're moving. And then when you stop, the nystagmus normally continues for a bit while your eyes try to get back in sync, and then they figure it out, and it stops. For me, this reflex didn't even start. Here's what happened for me. When spun to the left, my eyes barely moved, and then would go back to looking straight and just stay there. So I showed almost no VOR, and because of this, no nystagmus. After stopping, the nystagmus didn't continue because it never started. This is totally abnormal. Every mammal has this reflex. Even a dog. You spin a dog with these goggles, you're going to see the VOR. So I started doing chair spins to exercise this pathway for both vision therapy and functional neurology. And I would then touch a target afterward. So the VOR was very weak for me. And the pathway to stimulate my superior oblique was partially paralyzed. So how could I strengthen the VOR while also stimulating the superior oblique? This is an important concept. It's about taking what we know about physiology and integrating it. So if the reflex to adjust gaze based on visual stimuli is partially paralyzed for me, let's find another pathway. So what if we use the sluggish VOR, but in a direction to stimulate the superior oblique? That way we'd exercise both. So again, the superior oblique moves the eye outward and down. So what we would need to do, so for me it's my right eye, so that's to the right and down. So what we would need to do is stimulate the canals to get the sensation of moving up and to the left. How could we do this? Well, I could barely walk, but I just needed to learn how to do some backflips and then do a couple in a row. Yeah, that wasn't happening. So this is a full body gyroscope, and it's made precisely for this. Show you how it works. So apparently there's only a few of these in the world. And I don't have buku money laying around, so this isn't really an option either. So what if we integrated vision therapy, functional neurology, and aquatic therapy? Now this is a prettier picture than one of me doing backflips. But that's what I did. I did backflips in the pool. This would exercise the VOR and the pathway to my partially paralyzed superior oblique. So here's the theory behind this. This is a picture before doing the flips. Notice how the right iris sits higher than the left. You can see the white, let's see, where's the button? You can see the white underneath this iris, but not underneath here. So here we go. First, let's color the pupils. Then let's estimate where the eyes are. Let's throw a grid on them. I look awesome like that. And then that's what we have. Now let's even those out. And red eyes just look demonic, so let's go back to black. And let's put them over here. So these are my eyes before doing the flips. Now I flipped backwards and to the left because the VOR should tell my eyes to move down and to the right, or in the exact opposite direction, or in the exact direction that my partially paralyzed fourth cranial nerve had trouble with. I got pretty good at this. I was doing like 10 flips in a row. Not bad for a dude who could barely walk. So the theory was that by stimulating the superior oblique through one pathway, it would kind of wake up the reflex to automatically orient my gaze based on visual stimuli. And we hoped that my eyes would align more like that. So one day, I'm walking out of the pool, and I realized I'm seeing single. And I felt my face. I'm not wearing glasses. This was temporary, but it was encouraging. So I reported this to my optometrist and my functional neurologist, who told me to try something. After doing backflips, I would read some writing on the walls, but I wouldn't read it forward like normal. I would read it backwards and each character individual. So I wouldn't be relying on word recognition, but actually recognizing each character. So these are the results. Remember, in December 2011, I was assessed at a 9 diopter prism, and by July 2012, I was down to a 4 diopter prism. Now, I kind of plateaued at a 4. In fact, I'm currently wearing a 4 diopter prism, but the VOR got a lot stronger, and my nystagmus came back a great deal. So hopefully you see how important this reflex was for my eyes and brain.
Someone take me to a doctor, then take me to a church. Someone take me to a doctor, just take away this curse. Someone take me to a doctor. Someone take me to the hearse.